According to Harvard Medical Newsletter, the most causative factor for change in therapy is the rapport between the therapist and the client. For all of their technique, for all of their education, for all of their experiences, a good therapist really boils down to 3 specific things that they do to help facilitate that change. And I'll get right to it. The first thing a therapist does is create a container. Now, sometimes that's the room, or it's the relationship, the rapport between the therapist and the client. But this container holds the emotions. It allows the client to open up and to share. There's an old saying, we're only as sick as our secrets. And so that ability to feel safe, opening up, to talk, to share, and to get those things out really matter. Now, what this does by creating this safe container is it facilitates the client being able to vent. And venting is really incredibly powerful. To say the unsayable or to tell the story that has never been told before. This is powerful work that people do, and that's one reason why 100 years ago they used to describe therapy as the talking cure, because people talking, venting, sharing actually felt a great sense of relief. Number 2, a good therapist holds up a mirror. And I mean a crystal clear mirror. They're trying to be as objective as possible to reflect back for you what they have heard you say. I'm wondering if that relates to this. Tell me a little bit more about that. Can you see how that could be interpreted in this way or in that way? So by offering interpretations and observations, clarifying questions, and asking a little bit more deeply using that reflective language, what I think I heard you say was, did I get that right? Is that all of it? Because when we are talking, when we are sharing, the words are coming out from the thoughts in our brain. But being in an audience, having the therapist there, we automatically start processing it. Is that what I really mean? Is that what I meant to say? Now that I say it that way, I wonder if I need to keep thinking about it or even feeling about it that way. So that holding up of the mirror, a crystal clear mirror, allows the client to be able to process their issues. This is really powerful work being done in therapy. By the way, there are people in your life, good people, and maybe some not so good people. The mirror that they're holding up is warped. It's a funhouse mirror. It's showing you a distorted image. Why? Because they have an agenda. They want you to fit their version of what they imagine you should be or ought to be or ought to do. And that's why therapists are so valuable, because they are trained in providing as objective or clear mirror as they possibly can, so that you can do that reality testing and process your issues to the point of being able to make sense of them. The third thing that a good therapist does is skill building. Now, most people think that that's exactly what they're going to therapy for. They're going to teach me how to manage my anxiety. They're going to give me some homework assignments to deal with my depression. And that is true. Specifically, how to manage our emotions, how to process our own thoughts, and how to continue to do the homework when we get home. The specific behavioral assignments, but as well as the thought assignments. Homework should be, think about this until the next time that I see you. Process this a little bit deeper. Maybe you're going to be journaling. Maybe you're going to be using positive affirmations. Maybe you're going to be challenging some erroneous beliefs or testing something in your reality. I'm going to reach out and try to do things differently. I wonder if I can handle that stress. I wonder if I can handle not reacting or overreacting. When a client is able to get a homework assignment and utilize the specific skills that the therapist is teaching them or asking of them, they can put that action into their lives, which will facilitate change. So there it is. A good therapist really only does 3 things. They create a safe container for the emotions to exist. They offer a mirror for reflection to allow the client to process. and they teach specific skills and give homework assignments that facilitate change, hopefully the positive change. Go out and find yourself a good therapist. They do exist. Interview more than one.